Whether you use a BiPAP, CPAP, or invasive ventilation, having a procedure done, which requires any sort of sedation or anesthesia, can present a unique situation. Many medical facilities have strict policies for people undergoing procedures who use machines which assist with breathing. You may arrive for a procedure only to find out it has to be canceled and rescheduled because the appropriate medical staff or medical equipment is not available. Recently, my doctor wanted me to have a procedure done in which a scope was placed down my throat and into my GI tract. The logistics of the procedure seemed simple. However, the procedure required me to receive IV sedation. I was unaware using a ventilator would require me to jump through so many hoops just to get the procedure done. This week, I share some important information you need to know before having a procedure done while on a ventilator. When scheduling your procedure, find out what the medical facility's rules are for people who use a ventilator. Most medical facilities have very strict policies which dictate how your procedure will be done and who will be present during your procedure. As a general rule, anyone who uses a ventilator is not allowed to have the procedure done at an outpatient facility if the patient will be receiving any sort of sedation or anesthesia. The procedure must be done at the hospital with an anesthesiologist present. Most outpatient centers use an anesthesiology nurse for procedures. The nurse is able to administer IV sedation and anesthesia. However, the anesthesiology nurse is not able to run a ventilator. Henceforth, if you have a procedure done in which it is scheduled that only the anesthesiology nurse is to be present, the nurse will not be able to do anything regarding your ventilator or switching you over to one of the facility's ventilators. You will be left in a precarious and even a life-threatening situation. One thing to remember is that during a procedure, you will be lying flat. Please take this into consideration when planning a procedure. Even if you are able to breathe on your own during the day, during the procedure, it will be as if you are asleep. If you are not able to breathe on your own when sleeping or when lying down, you will need to use your ventilator during the procedure. If you need to use a ventilator during your procedure, make it very clear when scheduling the appointment you'll be using a ventilator. Every person you talk to, such as the person scheduling your appointment, the person registering you for the appointment, and the person calling to remind you of your appointment, notify them you will be on a ventilator and insist the medical facility is aware of this. Before arriving for your procedure, inquire about the logistics of your procedure. What type of anesthesia is going to be used? Will it be twilight sedation, IV anesthesia, or general anesthesia? If sedation or IV anesthesia is going to be used, the facility will expect the patient to be able to breathe on his own. If either of these methods are going to be used during your procedure, the medical center will need to make special accommodations for your breathing needs. For general anesthesia, using a ventilator will not be a big deal because all patients will be placed on a ventilator during the procedure. Also, it is good to ask who is scheduled to be present during your procedure. Will there be an anesthesiologist or a respiratory therapist? Does the facility have a ventilator available in case you need to be switched over for the procedure? It is best to ask questions and have all your concerns addressed before the procedure. This will help give you peace of mind and will help create a plan everyone on your medical team will be aligned with. If you are having a procedure in which you are only going to be sedated, you may be given the option to stay on your home ventilator. Use your judgment. If you're having a very fast procedure, which will take 5 minutes or less, you may feel it is okay to stay on your home ventilator. My general rule is that if the procedure is scheduled to last longer than 10 minutes, I ask to be switched over to the hospital ventilator. Most hospitals have a policy which states they cannot touch your home medical equipment. So if you're having a procedure done and stay on your home ventilator, and your breathing changes, requiring the settings on your ventilator to be adjusted, no one on the medical staff can touch your home ventilator. This can lead to a very bad situation. For safety, ask to be switched over to the hospital's ventilator. This will ensure your breathing is being monitored and adjusted during the procedure. Many medical facilities have new policies in place regarding who is allowed to enter its doors. When arranging for the procedure, ask what the medical center's policies are regarding having a caregiver or a companion escort you to the procedure. Some facilities will allow one person with the patient before and after the procedure. Other places will not allow anyone into the building except the patient. When inquiring about the medical center's policies, gently remind the person you have a ventilator. The rules may be different for you. Recently, when I had a procedure done, the hospital had a strict no visitor policy. When I got to day surgery, I was asked where my caregiver was, as the hospital requires either a caregiver or someone from the hospital staff to accompany a patient at all times when he is on his home ventilator. My mom had not planned for this. She had gone to eat breakfast. She then had to go back to the hotel, pack up, and check out. She was not in the position to drop everything and wait with me several hours until I had my procedure. Thankfully, my nurse took pity on me. She was going to be in my room, starting my IV, drawing blood, checking me in, etc. She agreed once she was done, she would move her computer on wheels workstation into the doorway of my room. This satisfied the hospital's requirement that someone was with me while I waited to have the procedure done. Recently, I was scheduled to have an upper endoscopy. When the appointment came through on my electronic medical chart, I saw it was to be done at the outpatient center. I had a similar procedure done at the same medical center 2 years ago. I know the hospital would not allow the procedure to be done at the outpatient center. It had to be done at the hospital. I contacted my doctor's assistant and told her I had a ventilator. I stated the last time I had the procedure done, it had to be done at the hospital. Could she please change the procedure location to the hospital? The assistant said she would notify my doctor. My doctor would change the procedure to the hospital if he felt it was necessary. The procedure remained scheduled at the outpatient center. The day before the procedure, I told the woman registering me I had a ventilator, and I was fairly certain the procedure had to be done at the hospital. She said she would ask the anesthesiology nurse if he would do the procedure with me on a ventilator at the outpatient center. The answer was no. The procedure had to be done at the hospital. Now everything was in a last-minute change. An anesthesiologist had to be scheduled for the procedure. The procedure had to be booked at the hospital. My doctor's schedule had to be changed. It was a lot of last-minute work for the outpatient center and the hospital. In the end, everything was successfully switched over to the hospital. But when I arrived, it was not noted that I used a ventilator to breathe. The day surgery unit had to frantically call the endoscopy unit and find an anesthesiologist for the procedure. They also had to notify respiratory and have them available to transfer me between units. It was a lot of stress for everyone, including myself. There is nothing like driving nearly 400 miles for a procedure and then find out at any moment it may be canceled because my doctor and his office were not aware of the strict policies the hospital had for someone using a ventilator. Before the procedure, the anesthesiology nurse said he would keep me on my home ventilator during the procedure. I was opposed to this, and I stated I preferred to be on the hospital's ventilator. The procedure was slated to last anywhere between 45 minutes and an hour. The nurse insisted I could stay on my home ventilator. When I was prepped for the procedure, the anesthesiologist spoke with me. He said he was going to switch me over to the hospital's ventilator to better monitor my breathing. Right before the procedure, I was switched over to the hospital's ventilator. After I woke up from the anesthesia, I was switched back to my home ventilator. I'm very thankful and grateful the procedure went well and my breathing was carefully monitored. Hopefully, if I ever have another procedure done with anesthesia or sedation at this medical facility, my doctor and his office will know the procedure must be done at the hospital. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a wonderful week and a great day. Bye-bye.